Hello, and welcome. Today we're diving into a complex and often misunderstood condition called septo-optic dysplasia, or SOD. This rare disorder affects the development of the optic nerves, pituitary gland, and a part of the brain called the septum pellucidum. Join us as we explore what SOD is, its causes, how it's diagnosed, and the ways it's managed. The exact cause of septo-optic dysplasia is still largely unknown. However, researchers believe it's a complex interplay of genetic and environmental factors. Some cases may arise from spontaneous genetic mutations, meaning they are new mutations not inherited from parents. There have also been instances linked to disruptions during early pregnancy, although the specific triggers are not always identified. Factors such as certain medications, viral infections, or even maternal health conditions during gestation may play a role, but these remain under investigation. Septo-optic dysplasia's impact stems from its disruption of crucial brain structures. The condition affects the optic nerves, which transmit visual information from the eyes to the brain. Underdevelopment of these nerves results in visual impairment. The pituitary gland, vital for hormone regulation, is also often affected, leading to hormone deficiencies. Finally, the absence or underdevelopment of the septum pellucidum, a membrane in the brain, is another characteristic feature. The combined effect of these structural abnormalities is what leads to the various signs and symptoms associated with SOD. Septo-optic dysplasia is a rare condition, estimated to affect approximately 1 in 50,000 to 1 in 100,000 live births. Because the symptoms can vary significantly and sometimes be subtle, it's possible that some cases go undiagnosed. It is not known to have a predilection for any specific race or geographical location, affecting individuals worldwide. The signs and symptoms of septo-optic dysplasia can vary greatly from person to person. Visual impairment is common, ranging from mild blurriness to complete blindness. Hormonal imbalances can lead to a wide array of issues, including growth delays, early or delayed puberty, difficulties with temperature regulation, and problems with thirst and urination. Some individuals may also experience developmental delays, seizures, and intellectual disabilities. The severity of these symptoms depends on the extent of the brain malformations and hormonal deficiencies. Diagnosis of septo-optic dysplasia typically involves a combination of clinical evaluation, neurological examination, and imaging studies. An ophthalmologist will assess visual function, looking for optic nerve hypoplasia, which is the underdevelopment of the optic nerve. MRI of the brain is essential to visualize the septum pellucidum and other brain structures. Blood tests are performed to evaluate pituitary hormone levels. Genetic testing may also be considered to look for known genetic mutations associated with the condition. While septo-optic dysplasia itself isn't classified into distinct types, it can be categorized based on the specific features present. For example, some individuals may have optic nerve hypoplasia and pituitary hormone deficiencies but a normal septum pellucidum. Others might have all three classic features: optic nerve hypoplasia, pituitary abnormalities, and absence of the septum pellucidum. This variability highlights the spectrum of presentation within SOD. The treatment of septo-optic dysplasia is focused on managing the specific symptoms and hormonal deficiencies present. Hormone replacement therapy is often necessary to address growth hormone deficiency, hypothyroidism, adrenal insufficiency, or diabetes insipidus. Visual impairment is managed with supportive measures such as corrective lenses, assistive devices, and specialized educational programs. Physical, occupational, and speech therapy may be beneficial for those with developmental delays. Regular monitoring by a multidisciplinary team, including an endocrinologist, ophthalmologist, and neurologist, is essential. Currently, there's no known way to completely prevent septo-optic dysplasia, given the complexity of its causes and the role of spontaneous genetic mutations. However, optimizing maternal health during pregnancy, avoiding known teratogens, substances that cause birth defects, and ensuring adequate prenatal care are important steps. Genetic counseling may be recommended for families with a history of SOD or related conditions. The prognosis for individuals with septo-optic dysplasia varies widely depending on the severity of the condition and the specific symptoms present. Early diagnosis and comprehensive management can improve outcomes significantly. Some individuals may have relatively mild symptoms and lead independent lives, while others may require more extensive support. Research into the genetic and environmental factors involved in SOD is ongoing, with the hope of developing more targeted therapies in the future. Recent advances in genetic testing and neuroimaging are aiding in earlier and more accurate diagnosis. Furthermore, scientists are investigating potential therapeutic interventions to promote optic nerve regeneration and improve pituitary function.